Hi everybody, this is Varsha from Tiju's Academy and I am here to have a discussion on a particular case in OET speaking, that is an unknown case. So first of all, let's look into the word unknown. What do you mean by the term unknown? It means that something which is unfamiliar or new to you. In the OET speaking context, an unknown case means it is their first consultation or you're meeting the person for the very first time. That is how I would like to mention here that an unknown case can fall under two different situations. It can either be an emergency situation or a non-emergency situation. So let's look into both of these scenarios in detail. First of all, let's have a look into a non-emergency situation. From the word itself, we're getting an idea that the person doesn't require any emergency care from our side. They are here to seek some advice or clarification regarding their condition or a procedure. So let's look into an example here. The setting given here is a city hospital, and in the scenario it is mentioned that you are a head nurse who is talking to a woman who has been facing problems related to skin rashes. She is very concerned and wants to get rid of the problem soon. So from the scenario itself, we got an idea that the person doesn't require any emergency care. They are here to seek some advice regarding their particular situation, that is skin rashes. So we'll be giving a non-emergency approach in this particular case. So how do we start this case? Let's look into it. So first of all, we'll be greeting the patient, giving a self-introduction, collecting information from the patient and then moving on to the case. So this is how we'll be giving an approach. Good morning, please be comfortable. My name is Varsha, I'm the head nurse working in this hospital. So from your face, I can sense that you are pretty anxious. May I know the reason behind that? Oh, I can completely relate to your emotions. Please be relaxed, we are here to help you. For the documentation process, could you please state your name and age? Thank you for that. So this is how we'll be approaching this particular scenario. Now let's look into the next scenario, that is an emergency situation. So wherein the setting given here is a community health center. In the scenario, it is mentioned that this parent's 6-year-old son has cut his finger which is bleeding freely. You examine the cut which is not too serious and you don't think he needs stitches. So from the scenario itself, it is clear that the child is injured and he is bleeding freely. Hence, this situation requires an emergency approach. So how do we start such sort of a situation? We'll be asking what happened at first. Later on, the examination is important so as to make sure that the child or the patient is comfortable. Then only we'll be giving our introduction. So this is how it works. Good morning. I can see that the child is uncomfortable and he's bleeding also. May I know what happened? Okay, I can really understand the situation. You might be pretty anxious. Nothing to be concerned about it. So can I just examine your child? Well, thank you for allowing me to do the examination. You don't need to worry about it because this is a superficial injury and he will be getting the immediate treatment from our side. Before proceeding further, let me introduce myself. I am Nurse Varsha working in this community health center. So, this is how it works. I hope you people got an idea regarding the unknown situation in two different scenarios. So, whenever you are getting an unknown case, look into the fact that whether it is an emergency case or a non-emergency situation and you can give an approach accordingly. So, for more informative videos, follow Tiju's Academy. Urappannu Vijayam.